I was sitting in my garden this morning, just watching the way the light hits the leaves, and I found myself thinking about a patient I saw nearly 15 years ago. His name was Arthur. He was a kind man, a grandfather, the type of person who always had a joke ready to make the nurses smile. He looked the picture of health, trim, active, always busy. But one afternoon, while he was simply reaching for a glass of water, his heart just faltered. Most people think heart attacks are like a lightning strike, sudden, unpredictable, and loud. But as a doctor who has sat by many bedside vigils, I can tell you the truth is much more haunting. The real damage to our hearts doesn't usually happen in a moment of drama. It happens quietly. It happens in the dark. It starts years, sometimes decades, before you ever feel a single squeeze in your chest. And the most heartbreaking part? It's often caused by a habit so common, so accepted in our modern world, that we've stopped seeing it as a threat at all. Today, I want to talk to you about the silent habit that is destroying our hearts, and I want to show you how to stop it before it's too late. I see so many of you carrying the weight of the world on your shoulders. I see it in the way you walk into my office, the way your shoulders are hunched, the way there's a tiredness in your eyes that sleep just can't fix. We live in a world that rewards us for being busy, for pushing through the pain, for ignoring the subtle whispers of our bodies. We've been taught that heart disease is something that happens to other people, or something that only happens when we're very old. But the statistics tell a different story. Heart disease is claiming lives earlier and earlier, and it's not always because of the things we're told to fear, like high cholesterol or a bit of extra weight. It's often because of how we live our daily lives, the rhythm of our days that we don't even think twice about. I remember talking to a woman named Elena. She was in her late 40s, a high-achieving executive and a devoted mother. She came to me because she felt fluttery. That was the word she used. She said, "Dr. Martha, I just feel like I can't catch my breath, but I'm sure it's just the coffee." When we looked deeper, Elena's heart wasn't failing because of a bad valve. It was straining because she had spent 20 years in a state of constant, invisible vibration. She was living in a world of always on. Most people don't realize that our hearts are incredibly sensitive instruments. They don't just pump blood, they react to every emotion, every thought, and every micro-habit we form. When we talk about heart damage, we often focus on the pipes, the arteries. We worry about them getting clogged, and yes, that's important. But there is something else happening inside those vessels. It's called inflammation. Think of it like a slow, smoldering fire. It doesn't roar, it just glows, slowly charred the delicate lining of your blood vessels. And what stokes that fire? It's often the way we handle the quiet moments of our lives. If you're over 40, I want you to listen very carefully to this part. Your body has a remarkable way of trying to protect you. It sends out warning signs, but they aren't always loud. Sometimes it's just a persistent feeling of being on edge. Sometimes it's the way you find yourself sitting for 6 hours straight because you're so focused on a screen or a task that you forget you have a body at all. We were never meant to be still for this long. When we sit, our circulation slows. Our blood becomes thicker in a sense. The enzymes that break down fats in our blood start to switch off. It's like a river that stops flowing and becomes a pond. Things start to settle at the bottom. But even this, the sitting, isn't the biggest danger. There is something deeper happening. I've noticed something over my years in the clinic. The patients who struggle the most with heart health aren't always the ones eating the wrong foods. They are often the ones who are carrying a silent, heavy burden of emotional suppression. We live in a culture that tells us to stay strong, to keep calm and carry on. But where does that unexpressed emotion go? It doesn't just vanish, it stays in the body. It translates into a constant drip of stress hormones, cortisol, and adrenaline. These hormones are wonderful if you're running away from a predator, but they are toxic if they are constantly bathing your heart tissues day and night, year after year. This part shocked even my most veteran patients. Your heart can actually shape itself around your stress. When you are constantly under pressure, whether it's from a job, a difficult relationship, or just the pressure you put on yourself, your heart has to work harder. Your blood pressure creeps up, not because of salt, but because your blood vessels are constantly constricted, ready for a fight that never comes. This constant tension creates tiny tears in the lining of your arteries, and your body, trying to be helpful, patches those tears with plaque. But the real tragedy is how we've started to treat sleep. I see so many people who wear their 4 hours of sleep like a badge of honor. But your heart needs those hours of darkness. Sleep is the only time your blood pressure naturally dips. It's the heart's only chance to truly rest and repair. When we rob ourselves of sleep, we are essentially forcing our hearts to run a marathon every single day without a break. Most people never notice this warning sign, but if you find yourself waking up at 3 a.m. with a racing heart or a mind that won't stop, that is your heart pleading for a different rhythm. And then there's the habit of processed living. It's not just about the fast food or the sugar, though those play their part by spiking our insulin and causing that fire of inflammation. It's the lack of realness in our lives. We eat food that comes in boxes, we talk through screens, and we move through climate-controlled buildings. We've lost our connection to the natural cycles that keep our hearts in sync. Your heart has its own internal clock, a circadian rhythm. When we disrupt that with blue light late at night or by eating heavy meals when we should be resting, we throw the whole system into chaos. But we still haven't reached the core of the issue. The biggest danger, the habit that is truly destroying hearts in our modern age, is something most people do every single day without realizing it. It's the habit of loneliness. Now, I don't just mean being alone. You can be in a room full of people and still be lonely. I'm talking about the lack of deep, soul-level connection. As humans, our nervous systems are co-regulated. We literally calm each other's hearts down through touch, through eye contact, through shared laughter. When we live isolated lives, our nervous systems stay in a state of high alert. Studies have shown that chronic loneliness is as damaging to the heart as smoking 15 cigarettes a day. It sounds dramatic, doesn't it? But the science is clear. A heart without connection is a heart under constant strain. I remember a patient, George. He had everything: money, a beautiful home, a successful career. But he was isolated. He had colleagues, but no friends. He had contacts, but no one to hold his hand. When he finally had a minor heart scare, he told me something I'll never forget. He said, "Dr. Martha, I spent so much time protecting my assets that I forgot to protect my spirit." We spent our sessions not just talking about medication, but about how he could reconnect with his local community, how he could volunteer, how he could simply talk to his neighbors. And you know what? His blood pressure stabilized more from those conversations than it ever did from the pills. What happens next inside the body when we ignore all of this is terrifying. The heart begins to remodel. The walls can thicken, making it less efficient. The electrical signals can become erratic. Your body is trying to warn you through fatigue, through a little shortness of breath when you walk up the stairs, or through that heavy feeling in your limbs. Please, don't ignore those whispers. They aren't just signs of getting older. They are messages from the most loyal friend you will ever have, your heart. I want to give you some hope now, because it is never, ever too late. The heart is an incredibly resilient organ. It wants to heal. It wants to find its rhythm again. And the changes you need to make don't have to be massive. You don't have to run a marathon tomorrow. You just have to start choosing real over convenient. Start with 5 minutes of silence in the morning, not looking at your phone, not planning your day, just sitting and breathing, letting your heart know it's safe. Move your body, not because you have to lose weight, but because your blood loves to flow. Walk outside and look at the sky. Eat something that grew in the earth, not something created in a factory. And most importantly, reach out to someone. Call a friend, hug a loved one, pet your dog. These small human moments are the most powerful heart medicine in existence. Your health is worth prioritizing. You are worth the effort. I want you to take a moment today to just place your hand over your heart. Feel it beating. It's been there for you since before you were born, working tirelessly every second of every day. Isn't it time you started being there for it too? If this message touched you today, perhaps you could share it with someone you care about. We need to start looking out for each other's hearts. Hit the like button if you found this helpful, and subscribe so we can keep having these important conversations. And please, leave a comment below. Tell me one small, healthy habit you want to start today. Maybe it's just drinking an extra glass of water or calling an old friend. I read every single one of your stories, and they mean the world to me. I'm Dr. Martha, and I want you to remember, you are cared for, you are valuable, and your heart has so much life left to live. Be kind to yourself today. I'll see you in our next conversation.